Morning, everybody. For those of you who it is afternoon, good afternoon. I am Dr. Lyudmila Bazhenova. As it was mentioned, I'm a thoracic medical oncologist practicing in San Diego, California at the University of California, San Diego. And my task today is to discuss two novel classes of systemic therapy, which is antibody drug conjugates as well as bispecific antibodies. So we first start with antibody drug conjugates. In order for us to understand what the antibody drug conjugate is, we first need to know what the antibody is. But before we go there, I'd like to discuss a little bit about chemotherapy. So chemotherapy is effective in patients with lung cancer, but sometimes it feels like a picture on a right. In addition to killing cancer cells, it does have an ability to kill healthy cells, at least initially. The mechanism why chemotherapy in lung cancer works, or in any kind of cancer for that matter, is the traditional healthy cell will recover faster than the cancer cells. And so you have an increased differential killing effect between healthy cells and cancer cells. And the reason why there are we call the broad toxicity with chemotherapy is because it has harder time differentiating between healthy cell and a cancer cell. And therefore, we always been looking for better chemotherapy options, or now we are entering what we call a smarter approach to chemotherapy delivery. And that leads me to the to the antibodies. So what are antibodies? So antibodies are a special Y-shaped protein, and you can see on the top right of my slide, an example of a Y-shaped protein, which is an antibody. Antibody are produced by our immune system. There are certain cells in our immune system called plasma cells, and sometimes B cells that are able to make antibody. Antibody is made by design. So when your body makes an antibody, it makes it for a reason. It makes it to attach to something that's called antigen. So antigen is also a protein or can be a sugar molecule, and that is generally present on the surface of any cell, healthy cell, cancer cell, virus, bacteria. And the antibodies are specifically made to attach a certain antigen. For example, if you see at the tops of my slides, you see that there are different antigen, different color, different shapes. And so this antibody will only fit or will only attach to a green antigen, will not attach to yellow or purple or blue because it is not designed to do so. And then, for example, at the bottom right corner, you see a cancer cell, and you can see on the surface of the cancer cell, there are different antigens, so like red, green, and blue, and they're like square and semi-oval and triangle. And so this antibody is designed that it's only going to attach to a triangle. It's not going to attach to the square or the semicircle. So you kind of think about antibodies is like a puzzle pieces, right? So in order for the piece to fit, the puzzles have to be created so the opposite side fits perfectly well. The challenge with antibodies is that it is a big molecule. So compared to chemotherapy, chemotherapy can go inside the cancer cells. Earlier, we were talking about EGFR targeted therapy. So EGFR targeted therapies, we call the small molecule inhibitors, and they are also able to go to the cancer cells inside. The antibody cannot do that. It has to attach to the surface. So the question is, if the antibody does not go inside the cancer cell, how does it kill cancer cells? Why? By attaching itself to the top of the cancer cells die. And there are several ways of doing it. So one of them is you look at, it attaches to the surface of the cancer cells and kind of blocks the signal through the receptor. So the way you think about it is like if you have an electric car and, electric mechanics, things is scrambled for one or another reason, your car cannot drive because all the electricity has been scrambled. The second way it does so, once it attaches to the cancer cell, it kind of marks the cancer cell for degradation by immune cells. So kind of you think about it like I'm attaching a post-it notes to the cancer cell saying this cell needs to die. And then an immune system will go in and kill that cancer cell. And the third ability of monoclonal antibodies in general killing cells is where what the antibody drug conjugates are specifically hijacking is an ability of the cell to take the antibody inside. So once the antibody is attached to the cell will kind of engulf the antibody and put it in the middle. And that's shown on the right side of the slide with a yellow cell. And you see the antibodies, you see that Y-shaped protein is going to be moved inside the cancer cells. So antibodies are great, but amount of antibody your body produce is small, and it's very difficult for us to extract that antibody from the human in sufficient enough quantities to kill cancer cells. And also your body has an ability to limit those antibody production, and that's called protection or self-immunity. So the body will not make too many antibodies. And so that's where the science helps. And then we use something that's called the monoclonal antibodies. So you can make a lot of those antibodies in the laboratory. And the reason why they're called monoclonal, because they are clones of one protein. So they are identical. And the way it's done in the lab, you take a mice and you inject the mice with an antigen. The mice will make an antibody. That's what every kind of being on the live being on the surface of the earth does. It makes the antibody. So then you sacrifice the mice, and then you take the spleen cells. That's where those cells that makes the antibody live. And then you take a myeloma cells, like a certain kind of myeloma cells, and you put them in the same petri dish, and those two cells will fuse. So they became a hybrid. And that's called a hybridoma model. And that hybrid is now able to make a lot of antibodies in a petri dish. And those antibodies, again, as a puzzle, they specifically design to attach to the certain antigen that you injected in the mouse in the first place.